All right, students. So moving along. First off, the cardiovascular system. The heart and all the arteries and everything, the systemic and pulmonary, is a huge topic. I'm going to be going through this. There's like 100 slides here, and we're going to knock these out pretty quick. I'm going to tell you what you really need to know. It'll just be way too much detail for you to be able to pick up in this real quick class. So you just need to know the basics. So let's just jump right into this. Now, with the cardiovascular system, we're talking about the heart. We're talking about mainly we already did the heart in the last one, but as far as the vascular, it's going to be all your blood vessels. So the pulmonary circuit. Pulmonary circuit is blood leaving the right ventricle, going through the pulmonary artery, goes to the lungs, comes out of the lungs. So remember, it goes to the lungs as deoxygenated, comes out of the lungs as oxygenated, comes back to the heart through the pulmonary veins. So remember, veins bring blood to visit the heart, arteries take blood away from the heart. Okay, so pulmonary circuit is right ventricle, lungs, left atrium, pulmonary circuit completed. Systemic circuit is to the body. So it's going to be left ventricle out through the aorta, through the aortic valve. So remember, the aortic takes the blood all around the body. Okay, they're going to go all through the body. That's the systemic. And it's going to return through the superior and inferior vena cavas into the right atrium. So that's going to be the systemic circulation, right? Now realize, the way it works is the atriums pump together, so both atriums pump together, and then the blood goes to the ventricles, and they both push together. So even though the heart is separated into right and left halves, atriums contract at the same time, ventricles contract at the same time. Okay, part of the walls. So remember, all the walls of the blood vessels are going to basically have the same thing, except for capillaries. Capillaries get so small that that's where the exchange happens of nutrients. So they can't have these thick walls. They need to be easy for things to just pass to and from. So they're all going to have, all the other blood vessels are going to have, it's referred to as tunicas. Tunic is kind of just like wrapped around. So I don't know. I just know that like a tunic for like a shirt is a shirt that goes like down and covers your butt. So it's like really long and it kind of wraps you over. So the tunica adventitia, media, and intima. Okay, so the adventitia is going to be the one that goes all around. That's the outer layer. The media is the middle layer with the muscles. The M means it has muscles. And the intima means it's going to be intimate with the blood. So it is the last layer right inside. So that is where the blood is going to flow through. Okay. Now, the thing about the muscles, the medial layer, is that's where we're going to have our vasoconstriction, our dilation, because those muscles are controlled by our nervous system. And pictures always work better. So as we can see right here, the adventitia is the wrapping, the media is the muscle layer, and the intima is the innermost layer. The area in the middle where the blood flows through, that's referred to as the lumen. So you can see a lot of nice red blood cells in here. No white ones in this one. How to distinguish arteries from veins is really simple. Let's just jump right to the picture. That's the best way to do it. So, in an artery, we're going to have this, the lumen, the opening, is going to be pretty distinguished. Pretty much always going to be kind of circular, whereas in a vein, it's going to be kind of a collapsed, weird shape. The main thing, though, is with an artery, take a look at the media. The tunica media is always really thick compared to a vein. Veins don't so much constrict, and they don't need a lot of muscle in there because veins don't have a pulse. They're not taking the brunt of the heartbeat, and they both have that adventitia. Know the pictures. Pictures always help out. As far as arteries go, we're going to start off with the aorta is the largest artery in the body. That thing takes all the blood right from the heart, from the left ventricle. It's big. It has a lot of muscle, but mainly it has a lot of elastic tissue in there, because when the heart beats, you feel your heartbeat every time you feel your pulse. You feel it hit. So when you feel your pulse, you're feeling your ventricles contract. So that's your systolic. So that's your ventricular ejection. So what happens now is you're feeling the heart being pushed with every beat. That is your ventricles contraction. Okay? So you have to have that elasticity in your arteries to open up and come back. So it opens up and brings it back. Okay, so our elastic is going to be our largest arteries. That is going to be our aorta. Let's just jump right into here, move on down. Okay, so elastic are 2.5 centimeters in diameter. That's about, I think, a centimeter. I think there's a little over 2 centimeters in an inch. So it's almost a 1 inch diameter. Okay, a lot of elastic membrane. So the elastic membrane is going to be just underneath the tunica media. You can see it there. So it just allows for it to open up and close. Nice and simple. Now the medium size are going to be the muscular arteries. So these are going to be the ones you feel your pulses in. That's going to be your radial. It's going to be your external carotid. Your brachial artery is going to be up in this area. Your femoral artery is going to be down, well, where your finger is, down in your hips. Radial you can feel pretty easily. Ulnar is difficult to feel. The carotid is easy on the neck. Brachial, if they're thin, you can actually see it on their arm. The femoral, that's in the inguinal region, so buy drinks first. And the mesenteric is going to be in the stomach area. And you can kind of see, got a nice amount of muscle in there. The reason why it has that muscle is this is what's going to constrict or dilate. So this is one that helps to control blood pressure, really. Now arterioles are, we have arteries, they keep breaking down, and then they get smaller and smaller until they become arterioles. Now, after arterioles, we go into capillary beds. So arterioles are really the smallest arteries that we have. They might not even have, their smooth muscle layer might not even be completely wrapped around. So it might be kind of sparse in there. So as you can see, the smooth muscle is just kind of, it doesn't completely cover everything. Okay, now the capillaries are the smallest. This is where we're actually going to have the exchange of nutrients. This is the most important part. So we have a lot of the endothelial, so the inner lining is going to be there. Then we go into fenestrated, which means that it's going to be, we're going to have cells in here, and this one's going to have maybe no hole, but then this one will have a small hole, no hole, and maybe a small hole. So it's not, has a little bit more structure until we get into our sinusoids, which now these are our capillary beds. These are the real ones, where we just have this really thin squamous epithelial tissue with a lot of space in between. So our artery will be set up, our capillary bed will be set up like this. And the blood is going to be going through in this direction, right in between. As it goes through, we're going to have nutrients that are going to be going off outside and bad stuff coming inside. Now as it goes through, it's going to be dropping off all the oxygen. When it comes out of this capillary bed, it's going to come out into a vein. So now the capillaries, they empty into a vein because oxygenated blood went into the capillary bed, deoxygenated blood came out of the capillary bed. Keep it simple like that, we'll be fine. And you kind of get the gist of this right here. Now, the main thing I just want you to know about capillaries, arteriovenous anastomosis. And anastomosis just means that two things touch and they fuse together. There's actually been reports of somebody's rectum and their bladder have touched and they've anastomosed. They connected together and then they form a fistula where they actually get a hole in between. So you're actually peeing out poop. Not really a good thing, but that kind of explains what anastomosis is. Now, the meta-arterioles, all they do is they kind of control the flow of blood, what direction it's going to go into these capillary beds. So as you can see right here, we have our oxygenated blood comes in, comes through this capillary bed, comes out, gives off its oxygen. Now it's deoxygenated, goes into a vein. Keep it that simple. Precapillary sphincters, they just control the flow of blood coming through here. That's all. It's just a way to control where the blood's going. Let me see. I think we just kind of took care of all of this stuff. Same picture. Don't worry about it. Okay, now we start off with large arteries. Then the large arteries become arterioles. Arterioles then get so small they go into the oxygenated part of the capillary bed. Blood goes through the capillary bed, gives off oxygen, gives off all the nutrients, picks up CO2 and other waste products. It empties the capillary bed and it goes into a venule. So the venule is the smallest vein. Okay? And then from the venule, it is now going to go into your medium-sized veins. So now from a venule, it's going to go into a vein. And then it goes to your larger veins, which are going to be your superior and inferior vena cava, jugular veins, things like that. Okay. So once again, venules. smallest ones. Medium-sized vein. Now you can see a bit of a tunica externa. It's becoming a little bit larger. Starting to get some elastic fibers in there. And this is where we actually have the one-way valves. So this would be your radial, your tibial, your popliteal vein. So it's the veins that we actually can see through our skin and our arm here. Okay. Let me see. The medium-sized ones, what I want to get to is the valves. Now remember, a valve is a one-way. It makes the blood's only going to go in one direction. So right here we got our gastric nemus. We got our calf. Now every time muscles contract, what they do is they're going to put pressure on these veins. Now the pressure on these veins pushes blood in one direction. These valves make sure that blood can't come this way. It's going to pool up. So blood can only be pushed in this direction. So we get enough pressure here because the muscles squeeze, the blood just goes rushing up. When the pressure is off the calf, the blood will try to come backwards, but the valves will close and prevent it from going that way. It's an amazing thing. There's an incredible dance that goes on between your arteries, your lungs, and your veins. The more you move, the more energy you use, the more energy is required. So your heart has to beat harder. Your lungs are going to take a deeper breath to get more oxygen in there. So as we're supplying extra oxygen and blood to our muscles because they need it because they're being used, the more you use them, the more they constrict, the more they push the blood back to your heart. So everything stays in this nice balance. So it's a wonderful dance that our circulatory system does with our lungs. Okay, the large veins, I just want you to see, once again, large adventitia, very little muscles in the veins. Okay? That's why veins can collapse. Okay, let me see here. Okay, because veins in the lower extremity, they have to go against gravity. There have been times, and I've actually seen this, when you're standing in formation, at attention, and you can't move. You can't move for there's always some dignitary giving a speech who thinks that you're mesmerized by him, and you want to listen to him while he's in the shade, and you're in the hot sun wearing a wool uniform. If you lock your knees, by locking your knees, you're not using the muscles of your lower legs. If your knees are bent, your muscles are constantly adjusting so that you don't fall over. And the constant muscles adjusting is putting pressure on the veins, which is pushing blood up to your heart. If you lock your knees, now you're just resting on your bones and you're not using the muscles. If you're not making those muscles contract, blood will pool up down in your legs, and when it pools up enough, all of a sudden somebody will faint. I've seen a lot of soldiers faint, and that dignitary was usually a congressman, thought that you were just so enamored you couldn't take him anymore and were just fainted because you were so willing to rush out and vote for him. We just wanted to get that half day off. Okay, so distribution of blood. I just finished telling you where blood can pool up in the legs. That's because our veins contain 65 to 70% volume of our blood. Our arteries only have 30 to 35 because blood is constantly moving in the arteries. Don't worry about that too much. Okay, so the circuits. So we have our pulmonary circuit I already talked about and our systemic circuit. Remember, the pulmonary is going to be pulmonary artery to the lungs, pulmonary vein from the lungs. Systemic is going to be aorta all the way around the body, vena cavas back to the heart. Okay. As far as the differences, all you need to really understand is the pulmonary circuit is going to have lower pressure than systemic because we're just going through the lungs. Systemic has to push it all the way through the body. Now, don't get me wrong, you can get pulmonary hypertension, but we have a serious problem. Walls of pulmonary arteries are thinner than the walls of the systemic. Well, it's not going as far. Okay, let's see. I think I just covered all of that. So, as you can see right here, pulmonary is just going from the heart to the lungs, from the lungs back to the heart. Remember, it leaves. Pulmonary leaves. Right ventricle comes back to the heart, left atrium. Systemic, left ventricle through the aorta, goes throughout the body. Okay, we're talking brain everywhere. Comes back through the vena cavas all the way to right atrium. Okay. Keep it simple. In the pulmonary, what happens is pretty simple. In the lungs, the capillary beds are going to go around the alveoli sac. In the alveoli sac, it is oxygen rich, so it has a lot of oxygen. The blood coming through on the capillary bed is depleted in oxygen. So as it goes through, simple diffusion. Oxygen from lungs, straight into the blood. CO2 from the blood diffuses into the lungs so we can expel it. Pretty simple. No energy too. Okay. Now, here's where things get a little bit confusing with the systemic arteries. So, it leaves the heart in the ascending aorta. So, we have our heart. The ascending aorta is going to come up. So, the ascending is part where it goes up. Then we're going to have the aortic arch. The arch is where it does the arch. We have the descending where it goes down. Okay? The descending then goes through the thoracic, then goes into the abdominal. Now realize that the way the heart is set up is kind of over on the left-hand side. Because it's over to the left-hand side, it makes it so that we're going to have these three branches that come off of our aorta. They're going to be a little bit unique. The first branch has to cross over to the right side of the neck. So this is going to be your brachiocephalic. Brachial is going to this area, cephalic is going up to your head. The next one goes straight up. So it makes a straight shot going up into your brain. So the middle branch right off your aorta is going to be your carotid artery. That's going to go straight up. It's going to split up into your, we'll go into that in just a little bit. Okay, let's just stick with where we're at. And the next one is going to be, this one's going to be your brachial. Okay. So brachiocephalic trunk, right common carotid, left subclavian. I like the way they break this up. Okay, best way to do this is take this picture, blow it up. As we blow this picture up, you can see right here. We are now, let me get that glitter pen again. So now we have our ascending aorta coming right up. Now we're going to our aortic arch. Now we're going to our descending aorta, and now it's heading down. This is our thoracic aorta, and it's going down into our abdominal aorta. Now, this right here is our brachiocephalic trunk. When I say a trunk, I want you to think like a tree trunk, and all the other vessels coming off it are like branches. Okay? So brachiocephalic trunk, that's the first one, and that's going to go up to your right common carotid. Okay? As it comes over, you can see it's going to come around, and it's going to go underneath this clavicle. So it's a subclavian artery now. The subclavian artery, and that's going to come down, it's going to break off into our radial and our ulnar arteries. Right? When that comes straight up from the middle, remember I talked about that? It becomes straight up to the left common carotid. And then we have our left subclavian, because right underneath our clavicle, and then it starts to come down. It's going to have all the branches that break off and go into, on our left side, our radial and our ulnar arteries. Okay, so the aorta begins with the aortic valve. I already mentioned all this stuff. I'm not going to repeat myself. You guys are smart. Right common carotid. It's going to come over here, right? You can feel your carotid pulse. Then it goes to your right subclavian artery, going underneath. Right? And then it goes down into, the next one's going to be the left common carotid, straight up. This is the branches off the aorta. Then the left subclavian artery coming down and going down into your arm. So here we have it. So we have our ascending, our aortic arch, and our descending. Brachiocephalic trunk coming up, right subclavian, this right here, right common carotid. Left common carotid goes straight up from the middle. That's the one you need to look at. That'll tell you what everything else is. Left subclavian comes up, goes underneath the clavicle. Okay, now, after it goes under the clavicle, so what's going to happen now is it goes underneath the clavicle. So subclavian goes underneath, and it comes on down. As it's coming down, you can actually see how it starts to branch off, and it gets smaller. It gets smaller and smaller. And we start getting into the, so right here, this is going to be the one that supplies all of the anterior arm. Going to split off. As it splits down here, this is going to go to the thumb side. That's the radial. This right here goes to the pinky side. That's the ulnar artery. Okay? Those are the ones you really need to know. That's about all you really need. Okay, so now I start talking about, let me see, subclavian. Axillary just means goes to the armpit. Thyrocervical means going to go to the thyroid area and the neck. Internal thoracic artery is just going down into the front of the thoracic cavity. Okay, and the vertebral artery. Vertebral artery we're going to get to in just a minute. It's right here. So here is the subclavian, sorry. This right here is going to be the right common carotid. And this right here is going to be the vertebral. These are the ones that are going to go up to our head and our brain. Okay, let me see. I think we already took care of these ones you need to know. Here's the fun part. When you do this with a cadaver, they want you to name these things, and when you look at it and you go in, you're basically trying to name every noodle in a bowl of spaghetti. It's been all dried up and clumped together. So this is, yeah, be thankful you're going to be tested on drawings. Let's see, the internal and the external carotids, pretty simple. So, common carotid breaks off. Brachiocephalic trunk, common carotid, breaks off into the external and the internal. External goes to the face, internal goes straight up into the brain. Okay. You don't need to know the lingo and all that. Not going to make a difference. Okay. Ophthalmic just means it goes to the eyes. Okay, it's easier for me to actually go and show you this. So what's going to happen here is this is your brainstem. So these are your vertebral arteries coming up from your vertebrae. So they come over here. Basal artery is where your vertebral arteries come together. Once they come in here, they're going to come around and they start to make these. It looks like a circle. It's called the circle of Willis. All right. Now, right up here, these arteries are going to be the carotid, internal carotids. This area right here is the common area for a stroke. Just to understand that. Okay. Descending aorta, as it descends, so we'd have a heart here normally. Heart, descending, coming down. Descends, so this is your thoracic, this is your abdominal. Just look at where things go to, okay? Your kidneys, that's going to be your renal artery. Okay, let me see. Your visceral branches. Don't worry about this stuff. So your abdominal, your celiac trunk. Your celiac trunk is going to be this guy right here. This is your celiac trunk. Superior mesenteric means it's just going to your mesentery, which is your digestive system. Okay. Remember, all these things are referred to as being retroperitoneal, so they're behind your intestines. So if it goes to the adrenals, it's the adrenal artery. Okay. So now we're going from the celiac trunk. I prefer to show the pictures. It makes more sense. So, celiac trunk. As you see, it's a trunk, which means it has a couple tributaries. So, we're going to have the hepatic artery, which takes it where? Over to the lungs. Hepatocytes, lungs. All right? Splenic artery is going to go down to the spleen. So, it goes down underneath to the spleen. Gastric just means it goes to the stomach. Okay? You get gas, you get a burp, it's your stomach. Okay. Let me see, as we're heading down. Good enough. Okay, so your mesenteric arteries, just understand that what they do is they just go to your mesentery, which means it's your digestive tract. So it's your large intestines and your small intestines. So take care of it that way. Nice and simple, mesenteric. So your superior mesentery comes from up by your stomach. Your inferior mesentery comes from underneath your pancreas. Let's see. Don't worry about these. Let's see, right down to adrenal glands, renal gland, renal. Yeah. Okay. Now, as we go down farther, we're going to get to our iliac. So let's go right on down. So now we have our common iliac. So common iliac is going to come down, and as it goes down, it's going to turn to your femoral. So remember, your femoral and your common iliac is up in your inguinal area. It'll split up. The one that goes to the posterior side will be your popliteal, and then it goes down into your foot. So don't worry about that one. With the foot, we're going to have our fibular or anterior tibular. Those are all okay. Yeah, don't worry about these guys. Dorsalis pedis is actually by your medial malleolus, and you can feel a pulse on that one. Okay, now how's the blood return? Okay, so when it comes to return, it's kind of better to take these things and blow it up. As you can see, we'll start from the bottom. So our saphenous vein is kind of on the lateral aspect of our calf. The saphenous vein is kind of unique because they'll take this guy and they'll take a piece of it out and they'll actually plug it in to your aorta and bypass a blockage from one of your coronary arteries. That is nothing more than a bypass surgery. Okay. So let's see. We had our femoral artery, so let's have a femoral vein. Makes sense to me, huh? We had our iliac artery, let's have an iliac vein. Iliac veins come together and they form what? The inferior vena cava, which heads up, goes to the heart. Okay, renal veins, because we have renal arteries. Keep it simple like that. Okay, over here, we had an ulnar artery, let's have an ulnar vein. We had a radial artery, let's have a radial vein. They come up and, let's see, brachial vein, don't worry about that, cephalic vein. The main thing I want you to be aware of is the subclavian vein. The subclavian vein gets a lot of things dumped into it, because as it comes over, it's now going to get our internal and our external jugulars. Now those are going to differ. Jugulars, you see, those when people yell, they get mad, you see the jugular vein kind of stick out there? Then that goes into our superior vena cava, which then jumps into the right side of our heart. Okay, let's see, I won't go too crazy with these things. Okay, so with this is kind of important to know because we are now going to have, this is our external jugular, internal jugular. Vertebral veins, just like vertebral arteries. So you can see the veins, there's more veins on the outside, which is why you get a subdural hematoma, it's usually going to be veins. Let's see, temporal maxillofacial, so internal, external jugular veins. So remember those, subclavian vein, right here, internal and external jugulars. I don't care about this stuff, okay? Just on the subclavian, brachial subclavian. Because so much dumps in the subclavian vein, you'll understand why I care about that later. This, though, I want you to be aware of as we move down. Let's see. We go to the mesentery. Okay, this is what I want you to understand. So your mesentery arteries and mesentery veins, they come together, and the arteries are going to supply the blood, and it's going to go into your intestines, okay, your capillary system of your intestines, so it can absorb nutrients. Those nutrients now have to go to your liver so your liver can process them. That becomes very important, because now we're talking about is the portal system. The portal system means that the veins don't go straight into the vena cava. The veins now are going to go, they're going to be ported somewhere different. They're going to port all the nutrients over to our liver, so our liver can process it, and then the blood's going to exit from the liver, okay, through the hepatic vein, which is then going to go to the up into the inferior vena cava. So just to understand, the portal veins, okay, so the portal system is where the veins, rather than going to the vena cava first, they're going to take all the nutrients from digestion to our liver to be processed. So remember, blood transports. That's the only thing you need to be aware of. Let's see. So we have, I don't like this picture for fetal. Just understand, for fetal, the lungs don't work. So what happens with the fetal is the heart, we actually are going to have a, so in a newborn, we have this foramen ovale. It's actually, we can have like the atrioventricular septum. So I want you to be aware of here, let me see. They really didn't do a good job with this. Okay. I don't even show you where it is. I'm not happy with this. Okay. So, Let me show you on this guy. So in a newborn, we shunt the blood, so it'll go to the lungs. There's no reason to bring it there. So your ductus arteriosus, this little line right here, so this is a developed heart once they're born. Before they're born, we're going to have blood that's going to come from the right ventricle. When it goes up into your pulmonary, rather than it going to the left and right lung, we're going to have a nice section of it that goes through here. This is actually an opening. This is, let me get rid of this fancy so make a connection. So this is going to connect into here. So blood, rather than going to the lungs, goes from your right ventricle into your aorta to be pushed throughout the body. We also have an atrioventricular septum. Okay, so we normally have a little hole. So the foraminal valve is this hole right here. It's going to go so blood can come into our right atrium, and it goes right into our left atrium, and it goes to the left ventricle, out through the aorta valve, through the aorta, throughout the body. Just ways to bypass. So ductus arteriosus is where this doesn't close, and so blood doesn't go to the lungs, get oxygenated. Atrioventricular atrial septal defect. So atrial septal defect is going to be a hole between the atriums, and that is another common one. These are two heart murmurs. These are your blue babies. Okay? Because the blood doesn't go to the lungs, it bypasses the lungs still, like it's in the womb. Because in the womb, there's no air. I think we took care of this. I'm happy.